Hey guys, welcome to Ivory Dental Group, my practice. Today I'm going to walk you through some efficient protocols for doing and managing hygiene so you can deliver quality care and stay on task. Come on inside.
Alright everyone, let's do a walkthrough of your first day to learn how to do efficient and quality hygiene checks. So first thing you're going to do is sit down at your computer, pull up your practice management software, and go through your day. Do you have everything ready for your patients? Do you know what you're doing? Can you see where the bottlenecks are, where you're going to get bogged down? And then look at your hygiene. Do you know who's coming in? Is there treatment plan left to be completed that you need to bring up at today's appointment? Do you have double hygiene? Is there a column or an hour where you have 2 hygiene checks, or possibly 3? Where can you break away during your appointment to hop in and do your hygiene checks? Is it before? Maybe right when you give a patient injection, right after that? Or while your assistant's taking an x-ray, or at the end of the appointment? So double check all those things before you get up from your chair. Then your hygienist is going to pop in and she's going to say, hey, let's go over the schedule. So I definitely recommend sitting down, walking through your schedule with each one of your staff. You can do that either in a team huddle, a lot of practices like a team huddle, or you can do it individually. And just walk through and say, hey, where are the bottlenecks? Mr. So-and-so last time had a crown he needs to finish. Let's bring that up today. This person needs a little more attention. Try to create personal touches. Try to create a personal relationship with each patient where they can be treated with really high quality personal care. And they will really respond. You'll build raving fans and your practice will grow. So do that with each staff member. And don't forget that your staff is so important and key to your success. By taking the time each day to sit down and look through our schedules as well as our hygiene schedules, we can identify bottlenecks at the beginning of our day and also anticipate when we can hop in for hygiene exams. It's also good to know what patients need to discuss treatment that's already on their plan. That might take a little extra time as well as patients that need a little more extra attention. So you've been able to break away from your first procedure. Then you're going to do your first hygiene exam of the day. So before we do that, let's talk about a couple key pearls. And number 1 is the huddle. We already discussed this, and this is anticipating at the beginning of your day, training and discussing with your staff how to anticipate bottlenecks and how to efficiently plan your day. And number 2, have the patient sitting upright. When you come in, when I walk into a room, let my staff know that I want the patient sitting upright in the chair so I can sit down and greet them at eye level. This creates rapport. Smile and greet them. And your first conversation with almost every patient should be non-dental. Ask them how they're doing. Ask them how their family's doing, where they've gone on vacation. I'll often put notes in every procedure or every hygiene appointment so that when they come back 6 months later, we can ask them a personal question about something that was going on in their life. And this creates really, really great personal touches that patients remember. They see, oh, my dentist care. They ask about what's going on. They know me more than just a number of patient. And then ask about their concern. So I'll sit down, greet the patient, and then ask about their chief concern. I've got the hygienist in the room as well. And she's going to report to me if there's any findings, anything I need to check specifically, any reports or changes in the patient's history. And then I'll begin the exam. When I'm finished with the exam, I'll sit the patient upright, discuss their treatment needs, options, and concerns, and then dismiss myself. And then guys, we're going to repeat this over and over all day long. So let's talk about some final lessons for doing hygiene exams in private practice. And number 1 is getting behind. You're going to notice that although we're going to anticipate and take the time to sit down and look through our schedule each morning, we're going to get behind schedule. Possibly the patient's going to come late, your procedure is going to get bogged down and get difficult, you're going to get behind schedule, or you're going to hop into your exam and there's going to be some huge finding that's going to take a lot of time to explain, discuss, and create a treatment plan for. So number 1 is to prevent that, anticipate your problems, do your morning huddles, look at your schedule. Number 2 is if you get into a bind where your patient has a huge treatment plan that you need to discuss, sometimes it's better to have the patient back. Schedule them back so you can go over all the options, or call them and say, hey, I'm going to call you personally tonight where we can get a little more personal time to review all these findings and make a plan together. Number 2 is develop your script. And your script is basically your wordage that you use every time you hop in and start an exam or explain treatment. And you're going to get better and better at this each year. But the goal The principles stated hereby are basically develop trust with the patient. Treat them with personal touch, respect, quality care, and don't talk about dentistry right away. I know it sounds funny, but sit down and get to know them. Understand what they need, what they want. That's big. Dentists who sit down and understand what the patients want, what their chief concerns are, and address those first before spouting off some dentalese terms, generally do a lot better at treatment planning acceptance, case acceptance than other dentists. So the goal in practice all around is create, develop trust, deliver quality care. So develop your script, tweak it, work with it. How are you going to walk into the exam? What are the first things you're going to ask? How are you going to develop that trust and that personal touch with each patient? So do that over and over, guys, and I'm sure you're going to do great, but just adhere by some of these principles with efficient quality hygiene checks, and let me know if you ever have questions. Thanks.